So good night here in Uruguay. Good afternoon in California, Tracy. Tracy Beth, her, did I pronounce it okay? Her?
Yeah, it's good. Buenas noches.
Okay, but let's talk not in Danish, neither in Danish or Spanish. We have to speak in English.
Okay.
So
And
Tracy,
everyone can understand.
first of all, thanks a lot for your time with me this time in this podcast, and for those in South America which do not know you so well as I know you. Perhaps you can briefly introduce yourself about what was doing Tracy before the pandemic, and then during the pandemic and the afterward.
Yes. Okay. So,
Okay.
I have to say I'm so excited to be on your podcast. I think not enough people know about it because I think you do a lot of shows in Spanish, but they're excellent. So I really hope that at least, more of the Spanish speaking world will start listening. So I live in California. I moved to California from Denmark in 2015. I have an MD from the United States, from Wisconsin, and a PhD from the University of Copenhagen in epidemiology. And I did my residency in physical medicine and rehabilitation. I did, after that, a fellowship in sports medicine and interventional spine medicine. So I see patients of all ages. I have 4 kids, and we still speak Danish at home. So we live like a very sort of Danish life in the United States. And we're in Sacramento, and also a lot in Tahoe, which is very close to Sacramento. I'm currently at UCSF. I did my residency at UC Davis. And that's how I got to know you, Sebastian, at UCSF. And I've been working in the Department of Epidemiology and Biostatistics, and been working on publishing a lot of articles related to the COVID-19 pandemic and sort of critiquing the policies that happened and are still going on, related particularly actually to children. I started doing research in COVID-19. I guess at the very beginning of the pandemic, I was sort of doing my own research, but then became, I guess, really involved at the local level in trying to reopen the schools and reopen sports. And so I used a lot of the Danish guidelines for reopening our sports clubs here in Sacramento, in particular my kids' football, soccer club, however you want to say it, and was really able to get them back with the team practicing like really early, because the shutdowns here in California were very strict, like even parks and trails and forests and were shut down. And it was really devastating to see what was happening to kids, especially my kids at the start of the pandemic. Let's see, how old were they? 8 and 11, my youngest kids. And then I have older kids that were stepkids in high school, and one was in college at the beginning of the pandemic. And I think especially the younger kids, I saw what was happening to them and their friends, sort of being trapped in their homes and really losing access to everything that they really loved about life, beyond like their core family. There was just like watching my kids not being able to go to soccer and play with the other kids on the playground at school. Like, it wasn't so much the academics, it was like the activity and the excitement and the meaning in their life that was gone, and it was taken away just so quickly. And then I worked to help like make guidelines for reopening a local diocese in Sacramento, that we were really one of the only places in the state that opened in spite of our governor's guidelines, for how they were very strict in terms of like the community transmission rates that schools were allowed to open at in the fall of 2020. But our grade school, we actually applied to be a daycare. And so because we applied to be considered a quote daycare, we were actually able to open before the schools. And so we had a really successful year where we had only one case that we thought might have been transmitted in the entire diocese, and this is over 5,000 kids, and this is up through 8th grade during the entire school year. And it was really sort of simple things that we were doing. And so I got interested in I guess I based a lot of what we did on what they were doing in Denmark and Norway, because I was following what they were doing
Yeah.
there, and I knew that they had very successful
You
school
have
reopening
a
there.
family in Denmark, so perhaps
Yeah,
they
we
were
still have
living another,
family in
like in
Denmark. I
another
still
world.
watch, yeah, we still watch the Danish news and sports and everything on TV. Like, we have VPN, and I read the newspapers, and I mean, it's there were kind of two different worlds that developed side by side during the pandemic. And I saw when they reopened their schools in April of 2020, and Norway did the same thing, that there wasn't like this big, there weren't these big outbreaks. And I was very sort of fascinated by why it was that children didn't seem to be transmitting the virus in school. And then also, like, why we weren't taking advantage of the fact that reopening schools didn't seem to at all be associated with an increase in transmission. And that was seen all over Europe. And the US like ignored it. And it really bothered me. And so I started actually studying that fall, this the Wood County, Wisconsin, these districts in sort of central Wisconsin, rural-ish Wisconsin, with some research physician contacts of mine. And their idea was sort of initially to make it a study about how well these kids could mask and how compliant they would be. And, I kind of was looking at the initial data with them, and I said, we really need to make this about how many cases are being spread during school, and how much transmission between the children and the teachers, and like what the prevalence is in the school compared to the community. And so we ended up publishing that with the CDC, and it really aligned with what Europe had found, that with very sort of simple mitigation, like they did mask, but they didn't mask during lunch. They didn't mask outdoors. They didn't mask on the buses. They kind of led normal school lives without most of them weren't distanced from each other. And there was very minimal transmission that we found in the schools. And so that was kind of like my biggest publication. I was senior author on that. And that was kind of what got me launched into doing research, because I realized right away that even though we found what should have been incredibly reassuring, which was very low transmission rates in the schools at a time of very high community transmission in this area of rural Wisconsin and central Wisconsin, like it was like the CDC started requiring even more things to reopen the school after our study. And so then after that, it was like, I kind of had to set everything aside in my life, because I could see what was happening, and I could see that like children were paying the price for people like either not interpreting research correctly, or making decisions based on political reasons. And so after that, I really started looking at all sorts of issues. I mean, we actually looked at testing in schools and didn't find that to be beneficial. This was with the same group in Wisconsin. We published on that in the Wisconsin Medical Journal. And then I started looking at vaccine-associated myocarditis, and have published 3 papers on that as well. Basically because I was aware of the fact that an accurate analysis of the data was not making it to the people, and the CDC and the FDA were not making decisions that were like science-based, and that unnecessary harm was being done. And so it's always been like this sense that I could do something, and if I didn't, like, I couldn't really live with myself. And so that's why I keep sort of pushing on it, and keep
I'm
doing
hearing you, and I think that many of us, in my case, I'm a pediatrician. I work at the pediatric intensive care environment with critically ill children. And it was, perhaps we can all agree that at the beginning of March, perhaps April 2020, okay, let's close schools. Might be rational to see what happens. I remember that with many colleagues, we have a PQ network, global network, and we try to elaborate a study, a prospective study to see what happened with this COVID-19 new disease and children. And we have a hard time to find really sick children admitted to PQs. So I think that as per perhaps May 2020 or June, we were pretty sure that COVID-19 were not messing with kids big time, and the age rating was pretty clear.
Yeah.
So
I'll just
school
add to
remains
that.
closed. Then
Yeah.
I, as a father, like you as a mother, start to get angry about this.
Yeah.
I mean, why still closing schools? Why this? Um, in a way, our societies forgot about children, and our societies thought or behave like this was uh, not going to harm children. And we had previous data from, I don't know, Second World War, when for war reasons schools were closed, and those uh, closures will had really long-lasting effects on these generations. So why do you think, if you had to choose, I don't know, two reasons why the US remain in 2020 and 21 as an outlier as a high-income country? Vinay Prasad usually says that if Trump would have said that please close schools or remain to remain closed, progressive and progressists and left-wing intellectuals and so on would have said, well, let's reopen them. Do you think that that was mainly a political reason? Perhaps another reason why the US behaved such an outlier, let's say?
Yeah, it's such a good question because it's hard to name just two reasons, but I mean, I think that you're right that it was political and it was one of the main things. And I say that because in the beginning of the summer of 2020, like I remember very clearly listening to Grand Rounds lectures at UCSF where they were talking about the importance of reopening schools and how it was very clear that children were mildly affected and it appeared like they were transmitting less than adults. And so I think scientifically, like all along, a lot of people they've like been there. They were like they even the initial data out of Wuhan, it was that thousandfold gradient
Yeah,
of risk
yeah.
between children and adults. Like that was like February. And so then in July and August, the conversation changed. And it was like, I feel like there's this sort of there's this cultural difference in the United States, at least from Scandinavia, probably from France too. I lived in France for a while. We talked about how I was in Guatemala for a while. So I've lived sort of many places in my life. And in the United States, I mean, there's this like there's this culture of like just stay quiet and sort of do what you're told and like fall in line with the right political party and so the dialogue around schools from what I could see in Denmark was so different, and it was the same with the vaccines. It was like there's this constant sort of debate going on and people aren't afraid of losing their jobs or getting canceled, whereas here it was like all of a sudden all the people that needed to say something in the late summer of 2020, like they just went quiet, after Trump said like, oh, let's open the schools, and suddenly it became a right left thing. you know, it's a huge divide in the United States between like who is like in terms of like in academic centers, almost everyone is Democrat. Like, and so, you know, there's a lot of peer pressure. And I think that that was part of it. And then I think really, you know, the teachers unions, they capitalized on that. And, you know, they probably were affected by what they were reading in the media, and they weren't getting the real information that they needed to hear from scientists and doctors because the doctors were quiet and the media was, you know, saying, oh, all these teachers died, you know, and then you don't get any information about, well, okay, well, where did they catch it or what, you know, they were teachers, but, and that happened in my own children's public school district. There was a teacher that died and it was all over the newspapers, like right before the schools closed. And then a month later, it came out that that teacher had not caught it at school. She got it at church. But the only reason I figured that out was because I did like this extreme search to figure out what happened to that woman, because, you know, we never found out in the newspaper. So it was like I found it in one little paragraph in something in her obituary or something like that. And then I was like, oh, and so I think it was a combination of the educated academic people who really should have spoken up, staying quiet for political reasons. And then, you know, the teachers unions get basically calling the shots, but, you know, making their calls based on sort of exaggerated, fearful information in the news.
I mean, we had data from Sweden, the Ludvigsson paper. I think it was in late 2020 that teachers were not a high risk group for getting COVID and dying from COVID. I mean, teachers during all the pandemic, even without the vaccines, had higher risk from dying from a car crash going to the school than from COVID.
Yeah,
so,
exactly
yeah.
right. And you know, it was they had lower risk than other professions, but then also in June of 2020, it came out that there was no difference in the community rates of the COVID-19 between Finland and Sweden, where Finland had schools closed and Sweden had schools open. And so it was like, well, what are we even doing? And the conclusion was, you know, you need to weigh the risks of school closures with the fact that, you know, we haven't found any benefits. And, you know, we should have always taken that. We should have looked at the European data. And like I said, I think many people did, but they just stayed quiet about it and they knew better. But, and then, you know, maybe we don't really value children and children's like right to normalcy in the US the way that other countries do. I'd be curious to hear your take on that.
In all Scandinavia, children have been really, they protect children from prior to the pandemic. Then the pandemic came and they treated the same way that they treated before. They care about children. So perhaps the pandemic was now that it has been officially declared over by Tedros and the WHO, but it was a mirror of the society. Our societies, like Mandela said, each society should be measured by the way they treat children, their own children, or that was the concept. And I think that same happened in many of Western societies. And that's why Scandinavia behaved well. And children in Scandinavia were just fine. They were not dying at schools, and they remained with their schools and their lives open. I mean, but, well, we can discuss, okay, 2020, the first year, 2021, the reopening of the society was difficult. But, well, you are the lead author of another paper that we published together these last weeks about the US still recommending masking for kids young, like 2 years old. It's irrational. This is irrational. So why is that? I mean, we have to elaborate something about why is that?
I know, and it's really interesting because, um, I kind of thought it had to be that people were like unwilling to admit that they were wrong, or like the sunk cost fallacy. Like, I believe that for so long, like it's really hard for people to say, maybe we didn't need to deprive children of seeing each other's faces, for years. Was that for no reason? And like, I think that's part of it. But then I also think, like, people more and more live in these bubbles, where they are surrounded by people who believe the same thing that they do, and they actually do believe it, and maybe they're not so good, or they don't take the time to really critically appraise the scientific literature, and maybe they don't know that, the observational studies that they're citing are terrible, and you really
Yeah.
can't learn anything about masking from them. And still to this day, in Congress, people are citing our Wood County, Wisconsin study as evidence that masks work, but we didn't have a control group. And it's like so insane to me that you can just say, well, obviously the reason that the spread of COVID was so little was because of the masks, when there's no control group. When Norway did almost the same study at the same time, and the kids weren't masked, and they also found minimal transmission in the school. So I'm just like, yeah, so why it's still happening? I mean, it is a combination of not understanding the scientific evidence, and relying on lab studies. Like, you probably noticed, I don't know if you noticed on social media, I got into this sort of like controversial discussion with many people about that
Yeah.
Scientific American article, where they said, well, we
Okay.
don't need studies
Need
because we have
randomized
evidence
control
in the
trial. Yeah.
lab. Yeah, I mean, I just don't understand that, because it's like, well, first, the title of that article was Masks Work, which is like, I understand it's hard, the title might be misleading, but they don't really, you need to say, well, which masks and under what circumstances, and what are you basing this on, other than like, you keep particles, like, it filters a certain sort of particle. I mean, I just can't believe that people are extrapolating that to like making a 2-year-old wear a mask. I mean, that's really insane.
We
And
have
they are
lost
saying high
common
quality masks,
sense. I
huh?
mean, there is no common sense anymore.
No,
I
I know.
mean,
And if you look on the CDC guidelines now, it's the public health emergency is over, and they're now talking about how to get 2-year-olds to wear respirators, and high quality masks, and then they're focusing on children with disabilities and saying they're at higher risk, and so they should be even, they should be the focus of the masking. And it's like, it feels like an upside down world. Like, and I think that's part of what we got into in our article, was like, how did we get to this point where, like, you need to have evidence to prove that masks are so harmful that kids shouldn't wear them, rather than we need to have some, good evidence of benefit. And we don't have that. All we have are like reports of all these harms, and like the obvious harms of children being uncomfortable and not being able to see each other's faces. And I get
these kind
really
of
mad.
discussions are not scientific anymore. I mean,
No.
if you ask my grandmother and you say her, "Hey, what do you think about masking 2-year-olds during like 2 years in schools? Do not see faces. What do you think they would that intervention will have any consequence?" And of course, she will tell me, "You're stupid, Sebastian. What are you asking to me? You know, of course, don't be an idiot." Because there is no scientific discussion anymore. I mean,
No,
uh,
I
common
agree with
sense
that.
has been lost. Most of the world is living normal lives today. And that's why I don't live in the US. I find so puzzling to me why they keep on doing that. I mean, they they will see what they wrote in like 5 years from now, and they will be ashamed of themselves about writing these guidelines, these stupid guidelines. I mean, the word
Will
is
they?
stupid. Yeah.
Will they? Well, I don't think that they're actually going to ever admit that they were wrong, which is actually why I think it's important that we publish things like this now,
Yeah.
because, I think it's like it is holding them accountable to an extent, to have people who are willing to speak up at the time and say, so there's a record of like, well, we knew it was wrong at the time.
Yeah.
And yeah, I do think that's important. But I agree. I think it has kind of turned into like a religious discussion where you don't actually need evidence. You can kind of twist things the way you want to.
I mean, a very important topic about this, Tracy, is like, for example, I do not live in the US, but many countries from South America, for example, mirrors what the CDC guidelines say. That's the consequences. The consequences of CDC guidelines go to all the rest of the world. For example, in Peru, nowadays, there is a large outbreak of dengue. Dengue, the mosquito
Yeah,
disease,
yeah.
transmitted disease. It's really, and it affects all ages. I mean, it's an endemic disease here in Latin America. And now, these weeks, they are suggesting the governments that schools should be closed because of these outbreaks. Like if the mosquito will choose to bite the kids only in the schools,
Only in school.
Yeah.
Right, because it's
But
transmitted by
this is one
mosquitoes,
of
right?
the long-lasting consequences. We have normalized closing schools all around the world. I mean,
I mean that's so ridiculous. I mean, but that it's just the argument that it was valid during COVID too. The same with dengue. It's like, well, what kids are going to get COVID outside of school if they're not in school, and it's the same with like being bit by a mosquito. One might actually think, if they're able to close the
only in
windows
school.
and
Yeah.
they could lower the risk for the kids. But you're right. I mean, and when I testified before Congress last month about school closures in the United States, and I guess, my one of my main points was, why wasn't it the default that schools should remain open unless you actually are able to show that it's more harmful for them to be there? And, I think those are the principles that at least they were working with Scandinavia. And I really wish the rest of the world would not look to the US and the CDC for guidelines. And I actually wish the US would start looking to Scandinavia. I mean, I would say even in Norway, I thought it was great that they said, well, let's do a cluster randomized trial of school closures while they're closed, or, and then we'll see what the difference is. And the government actually paid for that. They funded the project, but then the government decided, no, the harms are too great. We're going to reopen the schools right away. But there was none of that in the United States. And we certainly could have done that. But it scares me to think that, and I know that it's true because I saw the school closures all over the world, that so many countries were looking to the US. It was very obvious they were looking to the US and not to Europe. And you described that in South America because it was like divided between the countries that look to Europe for guidance and those that look to
in
the
the
United
Atlantic
States.
coast. Yeah.
Yeah. But that's why it's important. I mean, people say to me all the time, well, no one ever trusted the CDC. And then, fine. Okay, that may be true. I don't know, but we do look to their website to get numbers, to get statistics. Like we have to have a certain amount of trust because who else is gathering those data? And then if there are countries across the world that are trusting the CDC, like we obviously have a responsibility here in the United States to make sure that what is being the recommendation that's being put out is science-based and it's not doing more harm than good, especially for children.
Yeah. And do you think what was the feedback from the congressmen when you went to the meeting in the Congress? And
Yeah, I
do you
mean,
think that any congressman or in general people is shifting their view about school closures in 2023 or not?
yeah, I think they are. I think there wasn't enough room for debate and discussion because of the way that those hearings are set up. They don't really allow for discussion. They allow for a targeted question. And then it's like your time is over. And then another congressperson can say, well, it's very obvious that we needed more money for PPE and new ventilation to open the schools. End of story. Like you don't get a chance to respond. And so then that's their take, you know? And so then it's like people continue to live in these two separate realities. But I still think it's important to bring popular attention like to the subject so people say, wait a minute, not every scientist and doctor thinks that we needed more PPE and better ventilation to open the schools. And because I think the people in the United States and actually across the world got this idea, that there was a consensus when there wasn't. It was really a
No, it
question of a lot
wasn't.
of people
Yeah.
staying quiet or being censored, you know, or some way being threatened about losing their job or whatever it was. So it's a shame.
Tracy, how do you feel when you see, I mean, in California, in your city, the places you walk at, you know, public places, what do you feel or how do you feel when you see a young kid masking?
I mean, I get like I get angry. I don't know, because I just I it's I'll tell you, I was angry the other day when we went to the ER and they were telling the children in the children's ER to put masks on at UC Davis. And you know, and it included my son. And so I think, you know, particularly I don't get into people's lives or tell them what to do. And I'm just not, you know, I'd be more, I tell, like, I've talked to coaches and things like that, and I've said, you know, you really, I don't think medically it makes sense to have these kids wearing masks outside while they're playing soccer. Like, I
Yeah.
feel like I can say that. I mean, I feel like it's kind of my role to say that. And, you know, they obviously can make their own decisions. I don't tell other people what to do with their kids. But it does it makes me angry when I see children like coerced to be masking. And like, I know that my own kids, like, you know, they'll just like pull it down. I mean, like my 14-year-old, he'll just like take it off and just like don't tell me don't tell me to wear a mask, you know, like I
Yeah.
like that. But not all kids are old enough to be able to say that. And so I do just feel like not only are we forcing them to do something that they can't, that they feel like they can't say no to, but it's also like we're making them afraid of each other and afraid of infecting others. And so I
I
really
mean, they
dislike it.
were
I'm glad
treated
that most people,
like I don't know, a biohazard weapon, you know, children, like they
yeah,
were evil and they will like spread the disease. My wife in early 2020 was with one of our daughters, and she was told to, "Hey, ma'am, please take that child to your home. They are infecting us." You know,
really. Oh,
uh, yeah, that's kind of thing that we cannot normalize because in the future, near or maybe later, we will have another pandemic.
yeah.
It's like normal to have pandemics.
Can I tell you another story it's related? It's not masking, but it's vaccines, because I think we saw the same thing with children getting vaccinated and adults. And I would just say, you know, I just found out today there's still a mandate at the VA for vets to get the COVID-19 vaccine. I can't remember if it's the booster. I just got an email about it. I have to look into it. And I thought, oh my gosh. I mean, but you know, I have much to say about that, because we never, you know, mandate like statins or medical products in people. And this is not even a vaccine that protects other people, but like, even when it was, I mean, so my children didn't get vaccinated, and my oldest son, like for some reason they made that information available to the teachers, and they told him to get vaccinated because they thought he was going to kill them. Like they literally said that to my son in his school. And I'm not saying where it was. He's back in the public schools now. So, but I mean, this is the kind of thing that we are dealing with COVID, and I agree with you. Why is it going to go away in another pandemic that we're going to like continue to look at children as like a vector of disease? Monica Gandhi was the first person who said that. Like, why are we
Yeah.
treating children like vectors of disease? And then I was like, oh, we need to be friends.
Yeah, of
She was
course.
exactly right.
I mean, children don't vote today. They will vote eventually. They will
Yes,
grow
yeah.
up and they will vote. And I think it's really, really important to publish these kind of papers, to have this precedent of what was going on, and that there was not a consensus, although it might have been presented like there was one, but it wasn't. I mean,
Absolutely.
I have never defended masking children. I mean, the example of the US is an atrocity. Like 2 years old, you don't like kids. You don't like kids. I mean, you don't even understand them. And it was heartbreaking for me to watch the American Academy of Pediatrics in a way uh, doing advocacy for masking kids. They
Yeah.
did that, and I think that accountability is really important for the future.
I think so too. And, I actually think one of the things that happened in the United States was a lot of sort of scientists and people, doctors pushing for school reopening, they kind of did this like, consequentialist calculation where they said, well, if I say kids are of low risk if they go back to school with masks, then schools will reopen. And I think that ended up being a problem because I think a lot of people sort of were cornered into like advocating for kids to mask as a way to get schools to reopen, because they said, well, as long as they're in masks, then schools are safe. And if there's one thing that I regret about our Wood County, Wisconsin study, it's that I do think a lot of people took that message away from it. And I do think that that's what my co-authors of that study felt. And I know that I disagreed with them, but you know how when you write scientific papers, you kind of have to reach an agreement with, and so I basically was like, well, we just have to say what we found. And the kids were masking and we found low spread, and we said in there, we don't know if it was the masks. And that's really all we could say. But I do think that a lot of the dialogue in the US was sort of like, well, if kids are masked, then schools are safe and they can reopen. And I think a lot of that just stuck around. Like a lot of pediatricians actually were pushing for school reopening, but on the condition that kids would wear masks. And I think that's where we got into trouble, because I think a lot of people said, that we need that, even if they maybe didn't think or it was necessarily true, or they didn't have the evidence to say it. So maybe that's why part of the reason masking has stuck around for so long. But then also, a lot of people say, and I don't know if you hear this too, but they say, well, if masking doesn't work, why did the flu go away? Which is such a weird argument to me, because
Right.
it's like, well,
Yeah.
there are many reasons there might not have been flu that year. I
Yeah.
mean, I would say it's like, not like I want to guess, but if you are interrupting international travel and it just happens to be when flu is spread, I don't know why there wasn't flu that year, but why would you say it's masks when so much of the world isn't even masking?
Yeah.
And so I think there's a lot of misunderstandings and sort of strange beliefs that need to be dispelled. And yeah,
I
people
mean,
are religious people.
one
We
of,
were just talking about
of
Mashimon.
my yeah, one of my main learnings during the pandemic was like a pandemic is not such a medical or scientific thing, but rather social, anthropological thing. The way they end, the way they behave, or our behaviors, and when it comes to schools, it was beautiful to see them reopening and to see children coming back with their friends and uh, returning to their normal lives without masks. I mean, the first days, many children were masking here in primary schools. They lasted like 1 week.
Good,
Yeah,
good for them. Yeah.
children have much more common sense than we have.
Well, that's true, but I remember my son's friends, they were like, my sons were telling me, but they're my friends, like not their close friends, but a lot of the kids, they said they're afraid of taking their masks off. And that really made me sad because that just shows how afraid children got here.
They
Um,
were told that they will kill their grandparents.
yes,
I mean,
exactly.
there are many marketing, in the TV, in the media saying that. Uh, but I still think that they mirror the way our societies treat children, and we
Yeah.
don't get away from that. So bad news for the U.S. or for many parts of the U.S. They don't treat children so nicely like they, when they are running for elections, and they try to show that they like kids. They don't.
Yeah. Hold on, Sebastian, 1 second. All right, sorry about that. I knew that
Family
there was gonna
issues.
be
I
chaos
know
in my
them.
house.
Yeah.
Sorry.
Well, Tracy, my last question would be: how do you envision the following year? I mean, do you think that we are going to normalize our lives once, like, the WHO declare the pandemic is over, that the monkeypox thing was not such a thing, and so on? How do you think the next year in the US? Do you think that the CDC, with now Walensky stepping down, will change their policies? Will the common sense return or not?
I mean, I don't think so. I could
Okay.
sense that you don't either. I think that really there hasn't been an acknowledgement that really any mistakes were made or that anything went wrong. I just read that I guess Fauci just said on NPR that he gave the American response an A to the COVID-19 pandemic. And so I don't think that there's been a lot of discussion about how we're going to make things better in the future. I mean, there was an article in the New York Times yesterday that was really still arguing for, masking and better ventilation in schools and sort of, I think that the next year, I mean, I think a lot of people are just done talking about COVID, but I also think it's important to sort of look back and say, are there certain rights of humans and certain things that we did that we really need to sort of safeguard with like laws, like for example, I mean, Jay Bhattacharya had a very nice piece in Newsweek a few days ago that was about this concept, like allowing dying people in the hospital to have visitors. Like there's
No,
2 states now that have
that was
protect.
a nightmare. There were
Yes,
funerals here by Zoom. Funerals by Zoom in Latin America. There were. I have the pictures. I mean, people crying for their dead by Zoom, through Zoom.
I know.
We did that.
And I've read about, infants being separated from their mothers and even like infants that are dying in certain circumstances, their parents not being able to visit. Like I'm just like, how, okay, so first of all, I mean, yes, because that's happening, obviously we need to have some sort of legal protection so that doesn't
Yes, of course.
happen, right? But then it's also like, why is that happening? Why do people like not say something? And is it, hospital administrators making the decisions and then people are too afraid to say something when they know it's wrong? so that's one example, but then the vaccine mandates too. It's like we're still on the mandates. Like still, I just had someone write to me today saying I'm still being mandated to get a booster for this medical program that I'm, and it's like I just can't believe, I mean, that this is still happening. And so of course, if it's still happening, it's going to happen again in the future. And I'm sure that, we're going to have probably an even lower threshold to declare a pandemic, a state of emergency, right? Just the way things are, because then the government gets more money to spend to protect people. And so then we have another state of emergency, and then we have another set of public health rules and limitations and mandates that people are told to follow, like, and we had people losing their jobs over their vaccine mandates. And so I think it needs to be a combination of like setting up legal laws to protect people, to protect human rights to worship, for example, in church, rights to be with their loved ones in the hospital, and then I think that there needs to be like a cultural change along with it. But how do you get that if people are being made to stay quiet when they think something is wrong or hurting vulnerable
I think
people?
an important thing for us would be to try to put our lens in the places where the things were done well. For example, focusing on how Scandinavia behaved with children, with school closures, how they managed it to be, instead of looking at the bad examples. For example, regarding the visiting policies in hospitals here in my country, in Uruguay, in adult ICUs, it was forbidden to be with the sick parents or grandparents, But in my field, in pediatric intensive care, we didn't restrict any visitation. Parents were with their kids while sick. I mean, there were not so many because critical COVID in children was rare, but we didn't even discuss about getting parents out. So I'm sure that there are many examples all around the world of good examples and good policies. And that would be an interesting thing to do, to try to focus on where and how some parts of the world did things fine and protected the most vulnerable. Yeah,
that's
I
exactly
think that,
right. Yeah. Like Europe does have laws to protect patients so that they're able to to not die alone. And Sweden has a law that called Skolplikt, where all children have a right to be educated in person. And so they had that going into the pandemic, and they cited that a bunch of times when they talked about closing the elementary schools. So I think that's a good example too. But,
well, Tracy, it has been a pleasure, my pleasure to be with you.
You too,
Let's
Sebastian.
keep on discussing, exchanging ideas, try to avoid censorship. That was a nightmare to speak out loud during the pandemic, and you did that. You spoke out loud.
You too.
I thank you for that, and it's my pleasure to be collaborating with you and Binay and the rest of the teams interested on children well-being. So thank you for your time for this podcast. Perhaps the next one we can do it in Spanish.
That's right.
Porque tu español es muy bueno.
Sí. Más fácil que en inglés. Sí. Próximamente.
Muchas gracias, Tracy.
Muchas gracias.
Thank you.
Hasta luego.
Hasta luego.